Hi guys, welcome back. In this video, we shall be talking about what are the conditions if you're having a back pain and you're supposed to take an x-ray. Because back pain is very common. Many of us have experienced back pain once in a while in their lifetime. And if you're having a bad posture, overweight, you are doing certain kind of exercise in the wrong way. Let's say you're doing a deadlift, or you're not keeping your spine in a neutral state, you are arching, or you are allowing your back to round off, definitely you'll be having herniation of disc. Now, what is the meaning, or what is the factors that you should keep in mind that if you're having an back pain, you should go and do an x-ray. Very, very important. If I'm having an RTA, road traffic accident, or I'm having a history of injury, that means I was walking, somebody came and hit in my lower back, something came and hit, or I just fell from something, right? I fell from a height and I'm having back pain, definitely you need to do an x-ray. Along with this, if I'm having diabetes mellitus, definitely you need to do an x-ray. If I'm having any certain infections in my body, right? If I'm having any recent infection, let's say urinary tract infection, I should do an x-ray of my back. Along with this, if I'm having a history of cancer and I'm taking anti-cancer drugs, definitely you need to do an x-ray of your lower back. Along with this, let's say I'm having autoimmune disorders, and I'm having a lower back pain, and I'm thinking, should I take an x-ray or not? And I'm having autoimmune disorders, definitely you need to take, because in autoimmune disorders you'll be taking corticosteroids. So anytime you take corticosteroids, there's a high chance that there can be issues with your bones, right? If you're taking corticosteroids, let's say you're having SLE. If you're having SLE, you are taking corticosteroids. Definitely the one of the best treatment for SLE is corticosteroids. But the one of the biggest disadvantage of the corticosteroids will give you avascular necrosis in your femur head. Okay, so this is very, very important. So if I'm having corticosteroids, definitely I'm having a lower back pain, I should go and get a x-ray done. Along with this, now let's say if my nerves have been involved, how do I know that my nerves are involved? Remember, nerves are actually going to supply your sensory, that is going to give you sensation, and it is going to give you motor function. What is motor function? It is the strength of the muscle, the bulk of the muscle, right? And what is sensation? Maybe temperature, maybe touch, maybe vibration, maybe the 2-point discrimination. All these things comes in sensory functions, right? So let's say I'm having issue with my lower back and some of my nerves have been damaged. What is the thing going to happen? I will be having pain that is radiating towards my buttock area or my leg area. Definitely my nerves have been compressed. Along with this, if I'm having problems with my bowel and bladder habit, and my habit has changed, because the nerves that is supplying to this bowel and bladder is actually coming out from your lower back region. Along with this, if I'm having a foot drop, that means my foot is dropping and I'm not able to elevate my foot, I'm not able to walk, there's no strength, there's numbness, there's stinging sensation. This all suggests that your nerves have been involved. So anytime I'm having numbing sensation, tingling sensation, weakness, right, my overall sensation is gone, my power is gone, my bulk is gone, my nerves have been damaged, my nerves have been affected. So please do not take this lightly, right? Along with this, if I'm having diabetes mellitus, I might be having a recent history of infections, I might be taking corticosteroids, I might be a patient of cancer taking anti-cancer drugs, or if my age is, let's say, around 60 or more than 60 years, I'm having osteoporosis history. Along with this, I might be having, let's say I'm a very young patient, I'm having lower back. Do I need? No, obviously no. But if I have a history, definitely you should go. And along with this, if I'm a young patient and I'm having lower back pain, right, and I'm coming multiple episodes, this lower back pain is so severe, it is affecting my daily activities, and I'm not able to sleep, I'm not able to move with a ouch, that amount of pain, right? And it is affecting my daily activities, and it is recurrent. It is not just once in a while, it's okay, but it is recurrent, affecting my daily activity. Definitely need to go and get it checked. Please do not take it lightly, because lower back pain can be detrimental. Anything about your body, if you are not sure, it is always better to go and get it checked by a healthcare professional physically, right? So even it's like better, you don't want to be sorry, so be more be more cautious, right? So that is very, very important. So back pain, very common. So how do you avoid back pain? The first thing first is, do not get an injury in your back. Second, maintain your body weight very carefully. Third, you should have a good posture. Now remember, there's nothing known as the best posture. All the postures are good. The worst posture is something if you stay in any certain a position, that is the worst posture. That means you should be moving. If I'm slouching, you should sit straight. It's not that I should be sitting straight all the time. I can slouch forward. Again, I need to sit straight with straight back. I can turn this side, I can turn that side. So do not keep your posture stagnant. That is the most dangerous thing, right? So you should be sleeping in relatively a bit hardened cushion, not very sponge, because it does not give you adequate amount of support to your lower back. Along with this, people who are going to the gym, you need to be very careful whenever you're doing certain kind of exercise. So you need to make sure that how to keep your lower back in a neutral position. It's very important. You need to suck in your abdominal area, make your core tight, keep your back neutral, not overarch or not rounded. That is how you'll be training the muscles. You are not training for the bones, you are training for the muscles to have that stability and give that strength to your bones, right? So anytime you're going to the gym, just follow these two techniques, tips that do not do over in just one day. Do not start off with a huge amount of exercise in just one day, or do not go for overweight. Go slowly, progressively. Slow weights, less number of repetition, less number of sets. Go slowly, very less chance to be having an injury. And please train under a personal guide or professional who is expert in teaching you how to do the exercise. You should not get injuries in the gym. Gym is a place where you should be going in order to avoid the injuries, not to go there and try to impress someone and get injured. You're going to the gym to make yourself fit, to make yourself fitter than yesterday. There is only one competitor, that is you from yesterday. That's all, right? So do not go to gym and try to show off in front of your friends, take up a heavy number of weight and then try to do, and then you're out for like a couple of months. Maybe you might be paralyzed. Your life will be gone. So do not play around with this. Gym, go, make yourself stronger from yesterday. Don't compare with someone else, right? So this was a small video about lower back pain. Very common, actually, to be very frank, because most of the people nowadays are working in front of the computers with a very bad posture, and they're sitting for a very long time. So use the formula of 20-20-20. That means after every 20 minutes you want to see something away, around 20 feet away, for 20 seconds, and after every 20 minutes you should give rest to your eyes, and at least for around 30 minutes. Once you hit 30 minutes or 45 minutes, just stand up and just give a walk for at least 1 minute. 1 minute is enough, right? So it is actually going to relax your muscles, right? It's going to improve your blood circulation. And do not sit in your in a chair for a very long time. It is actually going to harm you. It is nowadays something known as silent killer. Sitting in a chair for a very prolonged time is known as silent killer. Bad posture to obesity to sedentary lifestyle to your hemorrhoids aggravation. Many things can occur, right? So do not sit in one place for a very long time. 45 minutes, give a break of 1 minute, just roam around and come back again, and definitely do come back, right? So okay, that was the video about lower back pain and x-rays. Thank you.